Neuroblastoma, a tumor that origins from embryonic neural crest cell that normally give rise to adrenal medulla or sympathetic ganglia. So neuroblastoma are the cancer of the sympathetic nervous system and most frequently found in adrenal gland. So neuroblastoma, as I told you, is a cancer of the immature nerve cell arising from adrenal gland or nerve ganglia or the neck. The most tumor develop in adrenal gland or retroperitoneal sympathetic chain. Other site may be within the neck, head, neck, chest, and pelvis. So in this picture, we can see this is the kidney and the two glands called suprarenal or adrenal gland. So neuroblastoma of the sympathetic nervous system frequently found in adrenal gland. Here said most tumor develop adrenal gland, but also possible to other side like head, neck, chest, or pelvis. So most children present with a tumor before 10 years of age, and most presenting signs are caused by tumor compressing adjacent normal tissue or organ. Diagnostic evaluation is aimed at locating the primary site of tumor. The prognosis is poor because of frequency of invasiveness of tumor and because the most cases the diagnosis is not made until affect metastasis has occurred. The younger the child a diagnosis and better the survival rate. So cancer develop in immature nerve cell. It is called neuroblast and often metastasize prior to diagnosis. So this is the very dangerous. And the age usually less than 5 years old, basically prominently attacked. The description: the surgery is performed to remove as much of the tumor as possible and obtain the sample for biopsy. In early stage, complete surgical removal of the tumor is the treatment of choice. Surgery is usually initiated to biopsy in the later stage because of extensive metastasis. Radiation is commonly used with late stage disease and provides palliative for metastasis lesion in their bones, lungs, liver, or brain. Chemotherapy is used for treatment for extensive local and disseminated disease. So in this picture, we can see the neuroblastoma or is two hairs, a solid abdominal mass, and definitely patient present with fever, fatigue, decreased appetite, weight loss, and bone pain. What are the other data collection or sign and symptom depends on location of tumor. Neuroblastoma is firm, non-tender, irregular mass in abdomen that crosses the midline, and urinary frequency or retention from the compression of the kidney, ureter, or bladder. Lymphadenopathy means the lymph node get involved, pathology in the lymph node or palpable lymph node, especially in the cervical and supraclavicular area. Bone pain if skeletal involvement occur, supraorbital ecchymosis, periorbital edema, and exophthalmos as a result of invasion of retrovalvular soft tissue. Pallor, weakness, irritability, anorexia, and weight loss. Sign of respiratory impairment, the sign of neurological impairment, paralysis from compression of spinal cord. So what are the post-operative intervention? So before post-operative intervention, I want to tell you what are the laboratory tests or diagnosis: ultrasound, bone marrow biopsy or bone scan, PET scan, or CAT scan or MRI's diagnostic test. The basic treatment is chemotherapy, surgical tumor removal, radiation, and stem cell transplant. So, monitor the sign of symptom related to the location of the tumor, provide emotional support to the child and parents. Post-operative intervention like monitor for post-operative complication related to location of the surgery. Monitor for complication related to chemotherapy or radiation. Provide support for parents and encourage them to express their feelings. Many parents feel guilty for not having recognized the sign in the child earlier. Also, refer the parents to appropriate community service.